Okay, good evening, everyone. We are all set for the live broadcast stream for today's Health and Human Service Committee meeting at 6 p.m. on HPA-TV, Comcast, and Frontier Government Channels 96 and 6032. It would also be streamed via HPA-TV, the HPA-TV Facebook page, and HPA-TV's Roku TV, Apple TV, and Amazon TV apps. It would also be rebroadcast and made available on the HPA-TV YouTube channel. So with us today, we have voting member Councilperson Rossetti. We also have voting member Councilperson Gale and Director Liani Arroyo from Health and Human Services. And I'm trying to see if there's anyone. Hold on one second. Okay. All right. So we'll go on with the agenda. We'll call this meeting to order. The first agenda up is the resolution on the Hartford Opioid Task Force, asking for an update on the Hartford Opioid Task Force. So Director Arroyo, the floor is yours.
Sure. Good evening, everyone. Just want to give a little bit of background information on the task force. And I know that Mark Jenkins has been with you and gave you some information on how the genesis of this all came together. Wanted to provide additional information about that. Essentially, we were awarded as the city a grant from the Department of Public Health, the State Department of Public Health, who had been awarded a grant through the Centers for Disease Control and Prevention to work on opioid prevention. And as part of that grant, we had proposed putting together a task force to look at the data that we now had access to and had gone statewide. I know Mark had mentioned in the last time he was with you all, the OD map project, and then this particular grant that we received that was right before the start of the pandemic is what's called Overdose to Action. And it was essentially, the goal of that was to use the data that we had available through ODMAP and be more precise and use the resources that we had for harm reduction and treatment in the community to deploy them to areas of more need. And so, as a part of that grant, we proposed putting together a task force. We received the funding for this grant. If I recall, we were signing the contract in February of 2020, and then the pandemic hit. And so much of what that work was doing was very limited in that we brought on an individual to work on the project and to produce data, which she did. And then Mark, to his credit, and I thank him always for pushing and making sure that this stays on the radar for us, had already started doing some of the work that we had funded him for through this grant, and started speaking with Chief Freeman, and the genesis of sort of the full circle of all of this actually coming to fruition happened at that point in time, approximately a year ago. And so we have had some meetings. We have discussed this grant, but COVID has essentially taken over, as you all know. And we have spent the last, I would say, 2 months working on some items that the CDC has asked the state from us, as well as the other entities that were funded by the other municipalities that were funded by the same grant. And essentially what has come from this group thus far are 2 items. One is a community resource guide that has been reviewed, and we did ask for a final review with a focus on looking at young people in light of what happened at SMSA last month. And the second thing that came from this group that was put together and presented to the group, and feedback solicited, and an additional round of feedback is being solicited now again in light of what happened at SMSA, which is a community response plan. community opioid response plan. The state requested that of us in December. We provided it in early January prior to the untimely death of the young child in the middle of this month. And we recently met last week, and we've asked the members of the group to those that were present to give it another review. So where we stand right now is a couple things. One, it's continuing to work on those items. We view those items as living documents. They need to be living documents. We need to be able to adapt and edit those items as needed and in response to what's happening in the community. And so there's that. And then the other piece of that is to finalize that community resource guide and make it public. It will likely be online and as well as some printed copies for people to be able to access. And then the group as a whole will be looking at and implementing the community opioid response plan. So that's what we're moving towards now. But the members of this group had been fluid at some point. It was a smaller group. It has expanded. People come, attend or don't attend, and we're now circling back to everyone that has expressed an interest. Those that we invited, those that members, the original sort of core group of individuals that were part of this recommended to be a part of this group, to re-engage them and re-invite them. We're at a different time right now. The numbers are going down on COVID. We have different options to be able and different ways to work with different community groups to address the issue of COVID. And so now we're at a point where we can re-engage people in what I hope to be a more meaningful manner and in a more engaged manner with them. So I'll stop right there.
Thank you, Director. Let me introduce, I believe we have our Majority Leader, TJ Clark, who is also a voting member, has joined us. We also have Corporation Counsel Attorney Osborne. And then we have Mark Jenkins, who is the Executive Director, Mr. Jenkins, of GHRRC, which is the Greater Hartford Harm Reduction Center.
Alliance.
Okay.
So I think you kind of got two of them. We were formerly the Greater Hartford Harm Reduction Coalition. We're now the Connecticut Harm Reduction Alliance.
Oh, okay. Okay. Great. And before we get started, Mr. Jenkins, Majority Leader Clark, I believe you have your hands up.
Yes, Mr. Chair, thank you. I just wanted to ask the Director a couple questions when it's feasible.
Yeah. I mean, I think you can go ahead. We were going to make the transition to Mark Jenkins, but please, the floor is yours.
Okay. Thank you, Madam Director, for your presentation. I had a couple questions. How could an organization be a part of the Hartford Opioid Task Force?
So, that's a really great question. We have not had that discussion as a group. Initially, the group wasn't meant to be a extremely large one. It was meant to bring together key community organizations that are doing the harm reduction work in the community on the ground, sort of those grassroots groups, and some members of city departments. But we are engaging in that conversation around expansion within the department. And so this is as good a time as any to bring that to the next committee meeting and put that into the next group meeting about how do we want to engage and bring on other partners. So I don't see there being an issue with bringing on other partners. I just think it's a matter of just formalizing that a little bit.
Okay, great. Because I have one organization in mind that it's operating in the space and actually serving our schools. So I think that they would be a great partner to be involved in this.
Sounds great.
Also, too, which really it disheartened me today when I read the news regarding the overdose in Bloomfield High, which hits home because of what happened to one of our students in the school system. So, can you shed any light as to? And I noticed that this high school actually had Narcan in their school. So do you know when Narcan will be disseminated to our schools?
I do not know the exact date. I know they were in the process of being trained. As Mark knows, when you are trained, you're given Narcan at that point in time. So I would have to just confirm that they actually have them in their hands at this point in time, but I can do that.
Well, depending on who's doing the training, some of the partners I saw that were mentioned that would do some of those trainings are not generally those who have those type of supplies on hand. And I know it was a question of who was going to provide them to the city at one point, whether it was going to be DCF or DPH or DEMAS. So I don't know, because I got out of the conversation early on when they opted to go with someone else for the trainings on where the actual medication was going to come from. I've always said that if somebody needs anything in the interim, they can always come see me.
We can confirm that. I'll confirm what the situation is and email Councilman Lebron with the information to share with you all.
Thank you.
Thank you. And one more question, Mr. Chair.
No problem.
All right, through you, Mr. Chair. Director Arroyo, given the fact that the governor issued his announcement regarding the termination of the mask mandate for schools on the 28th, it's probably too early for you to decide whether what's going to happen with our school systems, since he's leaving it up to the local health district.
So it is definitely too early, but I have not seen the actual written guidance, but I did listen into the press conference, and it's actually going to be the decision of the superintendent of the school district, shall I say, not the superintendent of the school district. So we're waiting to see the official guidance as it comes down from DPH. I have, worked closely both with Dr. Torres Rodriguez and with Mr. Sullivan of CRUC on this issue. So I suspect there would be some level of engagement on my part. But ultimately the decision is theirs. I can provide guidance and feedback, but the decision would rest with the school district as it stands. And as we understand right now, what the final guidance, written guidance looks like may change the conversation a little bit. But that was my understanding from the press conference.
So thank you, Majority Leader. I want to announce Madam President Mally Rosado has joined us, and I believe a Luis Rivera has rejoined us. So Mr. Rivera, are you here to speak on in regards to the opioid task force?
Hi. So I'm I received this invitation. I'm one of the commissioners for the Health and Human Services.
Oh, wonderful, wonderful. Thank you for joining us. So Majority Leader Clark, the next item is on COVID-19. So Director Arroyo is going to talk all things related to COVID-19, but just trying to bring us back to this opioid task force resolution. Director Jenkins, do you want are you willing to speak on behalf of this item? Let's see. Executive Director Jenkins, Mr. Jenkins, are you wanting to speak on this item?
I apologize. I apologize, Mr. LeBron. My phone rang at the exact same time you started speaking, and I abruptly just hung up on someone. When you called my name again, I'm like, oops, I don't know who that was. What was your question, sir? My apologies.
No, so on this resolution put in by, I believe it was Madam President Rosado, there was a couple items in regards to the opioid task force. So I assume you're here to speak on this item, correct?
Yeah, I mean, if necessary, I think Director Arroyo, spoke to it pretty eloquently. I am delighted to see there will be I anticipate seeing if there will be any more buy-in from fire and PD around, being a little more engaged in this task force. I do know Director Arroyo has been, buried with the COVID pandemic, and this task force has not been given the attention that it so deserves. It is a necessity for it to be productive. I'm committed. I'm committed to the process. I'm committed to the work, and to be a part of that process. The Director Arroyo and myself, we speak at length. She knows, as well as anyone who's been on any of those calls, I get frustrated because I don't think this traditionally has been an issue that is a huge priority for this administration. I think they understand the necessity for the work, but it's also one of those things that's not necessarily good for business. And what I mean is politically, it's just not one of those things until something unfortunate like this happens or has happened. So whatever is needed from the Connecticut Harm Reduction, and I've spoke with Council President Malley Rosado at length, however we're needed or to participate in this, then we will be there, and we're here for the residents of our great city. I hope that helps.
Yes. No, I'm not. So, yes. So thank you, Mr. Jenkins. Commissioner Rivera, do you have anything to say on this item?
Not at this time.
Okay. So I'm going to invite this resolve clause was from this resolution was from Madam President Mally Rosado. Council President, do you want to talk on this resolution at all?
Sure. Thank you, Councilman LeBron, and through you, Chair. Mark, thank you again for being with us this evening. I want to apologize for not being on the first half hour. I had a work-related issue and could not be on. When you say, when you referred to more buy-in from the police and fire department, what exactly, can you elaborate on that?
Well, if when you talk of coordinated responses, and now actually a credit to Director Arroyo, AMR is announcing a position where they're going to be hiring an outreach advocate to follow up on overdoses that happen in the city. This is something that we've done for the past year and a half, and getting ready to start up again as well. But someone who will probably through, and I know I just got off the topic of your question. Forgive me.
So let me ask you a question. When I asked you if you had statistics on how many overdose we had in the city of Hartford, and how much Narcan was applied, and the Narcan was successful in reviving, or I don't know what medical terminology you use. Are those the collaboration that you're seeking from fire and police?
Yes, well, yeah, really early on from them, from fire and police. Well, again, as Director Arroyo said, when we first got this going, it was in response to some fire and EMS wondering how it was that at the time GHHRC was showing up to all of these active overdose scenes, and why. So It was at that point, Director Arroyo had to answer to some folk and let them know who we were, and then Peter Canning would also let them know. And as a result of that, Chief Freeman put us all together, EMS and fire, to begin to discuss better ways to effectively work around better engage these scenes and responses to overdose. It was our hopes to have PD involved, also someone who can, relay information back and forth, who could speak to issues that may arise, questions, and that just, they haven't been front and center. Really kind of since the group went out to a larger, from that initial core group of fire, EMS, and Greater Hartford to the larger body, we kind of lost fire early on, and then EMS kind of went away also, but we did pick up some other constituents, some other public providers, and there's been some conversation. So now again, we need to revive that and really put some steam, under it again to give it the energy and hopefully start to look at some other outcomes and how we can better engage folk.
Okay, and this is going to be my last question, and then all the other questions that I have, I'll take them off topic and send you an email. So currently, and correct me if I'm wrong, you are looked as the expert within the state of Connecticut for Narcan, correct?
Yes, ma'am.
And so as being the expert, when I asked you before for statistics and data of how many overdose did we have in the city of Hartford, and how many individuals were brought back because of the Narcan, you did not have those statistics, correct?
No, we do, we know fatalities. There is, through poison control, the numbers we can report on of overdoses that have taken place, and actually this information is disseminated through Anuja in the office with Director Arroyo. So this information is disseminated monthly whenever we meet, how many overdoses there have been. It breaks down by zip codes where they took place. Again, those that are reported.
Yeah, can I chime in, Mark, if you don't mind, in terms of that question to
the
Council President Hosalo's question? The data that we have, it is what is reported to us. We know that there are many overdoses that are reversed that are never reported. And so what we have is the best data that is reportable. It's not always perfect. When we pull the data on a monthly basis, we often have to do some cleaning of it too, because multiple, sometimes a reversed overdose is reported multiple times. So the EMS may report it, and then sometimes the emergency room may report it as well, and then we'll go in and we'll clean some of that up. But on a monthly basis, what we have access to are those Narcan reversals, overdose reversals, at which EMS, where 911 was called. But again, we know that there are many overdoses that happen because people have Narcan available to them through MARC, through other groups as well, but primarily MARC here in the city, that never get a 911 call. And so whatever we report to you will likely be an underreporting. Okay. And we can't tell you how much of an underreporting it is, and recognizing that some of those individuals, what we haven't done is gone in and seen, at least of the ones that are reported, how many of those are individuals that have had multiple Narcan reversals, because we know that that also happens as well. So if you would like, I'm happy to work with my analyst at the office to pull together. She just did a presentation for the group, and she pulls apart the data between Hartford and non-Hartford, because that's the other thing to remember. When we report the number of deaths in Hartford, it often includes people that die in Hartford, but that are not residents of Hartford. So we break up that data as well, so that it's clear how many Hartford residents are affected and how many non-Hartford residents. And she does do the same thing to the extent that that data is available in terms of a city of residents of on the OD. So happy to share her latest presentation with you. And then if this is something that the committee would like on a regular basis to share that presentation, because she does do it monthly, and she may also do it weekly depending on, there is the OD map, which is a program that we have available to us, that Mark Jenkins also has access to, and other providers have access to, is that when an overdose is reported to poison control, we have a trigger for a number of overdoses that then we get triggered as a health department. And we'll go in and we'll see if something was reported multiple times, or if something was, did we truly have 12 non-fatal overdoses in a 24-hour period? And if so, were they all in the same area? Because if that's the case, then that serves as a trigger to us to reach out to PD, to reach out to Mark and say, hey, we just saw this. What's going on, EMS? Can you give us some information? Do we need to work with Mark and the other partners that we have to get resources into that community? So that's what we've been working towards doing with this task force. And there have been times where I will say we've been more successful. I think right before the pandemic, Mark, Mark can tell me if I'm on the right track here or not, but when I think of the level of engagement that we had prior to the pandemic, was when we had a rash of sort of abnormal ODs, we quickly came together, and we've done that multiple times in the city, quickly came together, quickly worked, had one voice that we spoke with as a city, and had responses to that. And that's something that, because of the pandemic, hasn't been the same. And that's where we're hoping to get back to.
Thank you, Director Arroyo. Mr. Chair, I'm all set.
Okay, thank you. So I have a couple questions. So my first question is in regards to the structure. Who's the chair of this task force? Like who's running this task force? Is it Director Arroyo? Is it Mr. Rivera?
No, it's through the city. It is Anuja. We don't have it. It's not formalized with chairs and co-chairs and all of that. We've never been that formal. I didn't want to get caught up too much in process at the time, but we just work together. I think if this group gets larger, then yes, we're going to have more process to this and have more of that. Because I think to Mark's point, the larger we get, then it could take us in different ways. And the reality is we initially came together because of this grant, so we need to make sure that some of the grant items are taken care of so that we're in a good position to be refunded. But that doesn't mean that we can't take care of other things that pop up as well, because there's a desire to address those other things as well.
Thank you, Director. And so with that structure, if I'm hearing Mr. Jenkins correctly, and I'm hearing the group, it's a task force that kind of comes together, but it doesn't meet with regularity. Would it make sense to?
We meet once a month.
You meet once a month?
Yes.
Okay. That's good to know. So then the next question is, has there been any engagement? Myself and the mayor, mayor found $5 million in funding. I had put in a resolution last year, I think 18 months ago now, for a differential response to a civilian crisis response team. Part of that, the tangible aspects of that was having different types of responses. And one of the responses that came up as we were discussing was, having people that are experts in substance abuse and overdoses and those types to engage rather than a police response per se. Has there been any discussion with the task force on what their opinions were on what that substance abuse kind of opioid response would look like in terms of the rollout?
So at this point, no. Patricia McIntosh, I sat on that committee as well, and Patricia McIntosh sits in my office. She's now going to the COO's office, but we remain in close contact about this. And so there's a big focus right now on some of on the logistics of some of the overarching response. I know that this is on the agenda as one of the additional responses that has to be looked at. It came up today in my manager's meeting as well with Patricia. So it is definitely on the agenda. They are, I think, just working through some statutory items that have to be looked at in terms of when EMS can come and things like that. So we've been engaging, Patricia has been engaging the state on some of this as well. So I think there's more to come on that. And Patricia will be working as well closely with us on the task force. So there will be synergy between both of them.
Thank you. And so the resolution itself had some items in the resolved clause that I just want to reiterate. So there were three things in particular. So some type of report from the task force that had recommendations as it pertains to awareness, I believe, addiction prevention, treatment, and overdose and prevention. And the second piece was some type of educational forums. And lastly, some type of strategy on public engagement. I know that we have the grant responsibilities to that. I would imagine that they're using your word, there'd be some synergy or some potential overlap with those items, not trying to create more work. How are we, or what is the feasibility of coming up with those items out of the task force?
I don't think that's an issue at all. I did mention this at the last task force meeting, if Mark recalls, that that some of this was also happening. We will take this, bring this into the task force. I think it's an easy thing to do. There's a desire to raise awareness around this issue. I think there's lots of work that can happen, lots of opportunities to seek additional funding for this work, and also to look at this. And, Mark and I have talked about this as well, that, when we're doing harm reduction, that's one level of prevention, but we also need to look at primary prevention, and that there's opportunities there. We will look at the data as well. We don't want to be driven. I just, want to put this out there. We don't necessarily want to be driven by crisis. We want to be driven by what the data says. Right. As horrible as this incident was, it is something that is extremely rare. And we went through that data in this last meeting. It does not mean that we don't find a way to address it. And I think you saw the press release that went out, is that there's lots of activities that are happening. They're not coordinated. And part of this task force is going to be now working to coordinate some of these different entities that are working at this within the city. So that is something that has already been discussed. And to get to Mark's point about just more of that collaboration and working together to address these issues in a coordinated fashion. And I think, there will likely be multiple approaches to this depending on what the issue is. If it's, directly related to opioid reversal and treatment and all of that, Mark is our expert on that. He's the go-to not only for us, but for the state and the federal government. And so we acknowledge that and work closely with him. And, as he's aware, when there are extra pockets of funding, he is who we go to and we ask, what can you do for this, for this extra funding? He's always been willing to do additional things as funding becomes available. As we think about children, there's a lot of work, I think, to be done with parents and destigmatizing this and having those conversations. And I think many of the experts that have been working with Hartford Public Schools, being a Hartford Public School parent myself and having sat in on some of these, are talking a lot about that, engaging parents. So I think there's an opportunity to do engagement there. But there's a stigma that we know that is a priority to work through. And I think we can look at this and add on while keeping the core group and the core work at the heart of what we're trying to do. But as funding sources diversify, we can also diversify. And that may mean having a core group, to Mark's point, of people that are working together. And there may be being subgroups to this core group if it gets too big.
Thank you, Director. So, Director, just in terms of timing, I don't want to put the gas on it. I mean, I think that this is a topic that we at Health and Human Services should keep our finger on as well. And a pulse on. What would be a realistic aspect in terms of coming back on these items? 2 months, or should we speak quarterly on this topic?
I think quarterly is great.
Okay.
What we will have, I'm expecting by the next monthly meeting, the final draft of the community guide that can go out, again, understanding that it is a living resource. And Mark was critical in helping with that. He had a smaller community guide that had been out there. This has is a little bit larger, but it's built on a lot of the work that he's done already. And then the community opioid response plan is something that, again, is a living document that we can ask others to take a look at and continually improve and work on. So I'm happy to report on something next month, but if we put it on the agenda for quarterly, I think that's
absolutely. Thank you, Director. Mr. Jenkins, I see you have your hand up.
Yes, sir. And with no disrespect whatsoever to the Director, we have to be a little more proactive right now. I have made sure, and I have distributed over the past 3 years, well over $3 million of naloxone and Narcan in this city that the city has not paid a dime for. Yes, Liani is correct. And this goes, but that whenever some pockets are available, they do try and see that we get something, but it by in no means, when I say we have a massive problem that just really hasn't been engaged or supported, because that's all we've gotten is what anything can trickle down. And when I say that, and thankfully for this OD2A project with, 70 in the first year and 50 in the second, which they found some more and kicked that up to 70. But I mean, if you talk about the return on investment that we provide versus the city, meeting us, I mean, even from last year, we were taken out of the CDBG with the hopes of, or as it was proposed, to get some money out of the ARP funds. Here we are again, coming around to another year of the CDBG, and we still never got any funds out of any of that money last year. So do I at some point I have to advocate to say, we're here. We have been the city's response to this, and we will do so. We'll continue to do so. But we do need the city to reciprocate, because they, I mean, correct me if I'm wrong. Just in 2020, was it 2019, 2020 alone, there's over $2.5 million in naloxone that we gave away in 2019, that, the city was the benefactor for. and not just the city, you know, when we go to the other monies that have come in or the other resources that we've brought to bear, they don't, it's not apples to oranges. And I know Leonie's hands are tied because, as I said, this has not been, we're not good for business, you know, and we would, you know, we would like to do a lot more, but we're restricted because it costs. And I mean, even, you know, with what we have gotten from the city, we use it. We have staff out there right now, 6 days a week from 4 o'clock to 9 o'clock. And we didn't get gas for that. It was just pure staff support. You know, everything else, nothing else associated with it. So we're going to provide those resources because that's what we do. My job is to make sure we stand in the gap. And right now we have some huge gaps. So I guess, again, with all due respect to, you know, to everyone in this forum, you know, we need some help.
Thank you, Mr. Jenkins. So I'm having a hard time seeing everyone's hands. So if anyone else wants to speak up, feel free to do so. Okay. And I believe since this is a report and or the resolve clause is asking for some specific items from the task force, that I don't think we need to vote on this. Is that correct, Attorney Osborne?
Are you asking whether the resolution needs to be voted on?
Yeah, yes, does the resolution need to be voted on? Yeah, I mean, yes.
I would recommend that it does, just okay, because it's formally asking the task force to do concrete actions.
Okay, thank you very much. So I'll take a motion. The chair will entertain a motion.
Mr. Chair.
Yes, sir.
Before I make whatever motion it is you want me to make, but I guess I'm wondering, do you want to have if we send this back to council, we're going to approve these things that are requesting this task force to, and I don't know if do you want to send it back now? Do you want to hold it in committee for another month for that first quarterly report that Leonie mentioned for? And I'm happy to do it either way. That's a good point, Councilman Gale.
Chair, yes. Through you, Council President's raising her hand.
Oh, okay, Madam President.
Yes, through the chair. I wouldn't mind tabling this resolution.
Okay.
In committee until we get that first report.
Okay, will do.
Thank you.
Okay. All right. So I'll take a motion to. Is it postpone, right? I guess it'll be postponing, right? Not tabling.
Postpone it. Yeah.
Yes. Yeah, so that
keeps it in this committee. So I will move to postpone this.
All right.
So I'll second that.
All right. So we have a motion that has been made on the floor and properly second. All in favor, say aye.
Aye.
Any opposed? Any abstentions? Seeing none, the resolution has been favorably postponed until we receive the quarterly reports. So Director Jenkins, you're welcome to stay. We're going to move on to our other item. You're welcome to stay. And Commissioner Rivera, you're welcome to stay as well. We're going to be moving on to item number 2 with it, which is Director Arroyo and the director's monthly update in regard to COVID. Looks like things are heading in the positive direction, but maybe I don't want to say positive, heading in the right direction. So, Director, the floor is yours.
Great. Yes, we are seeing the same decline that's happening across the state here in the city. We had a more than 50% decrease in the number of cases, similar to what's happening across the state. The last 2-week period for which data was reported was last Thursday, and that is for the 2 weeks prior. And so just looking at that, the first week of that reporting period, we had 788 cases reported. The second week of that period, we had 372 cases reported. So still a high number, but significantly lower. I said more than 50% drop. We are also seeing, as Councilwoman Rossetti knows, a drop in the number of cases coming out of our shelter system, which is also great. We just brought back one of the shelters that we had moved to a hotel, and the city supported that effort. The state paid for the hotel, but many of the staff do not have vehicles, so the city supported that effort by paying for taxi cabs for the employees to get to those jobs, some of which were Hartford residents, and then a couple were surrounding towns. But that was able to keep those individuals safe. Mark's not here, but his team also provided support to that effort as well through, I believe, CARES Act funding that the CAN has available to them from the city. So we're seeing the numbers go down, which is fantastic. And as I always mention, you know, how much of this is attributable to the home test? Probably some percentage of it is attributable to home testing that's not being reported, but that's not all of it for the decreases that we had, which are so large. And so in terms of what that looks like for our case rate, it's 67.9. I believe this past week reporting of the data, we were 99 out of 169 towns in terms of our case rate. We had a test positivity rate of 15.1%. Just as a reminder, test positivity is affected by the number of tests that are done in any given week. And so as the number of tests going down, even though we have less cases, that positivity may not come down as quickly just because we have fewer people doing tests. But that's really great news. You know, similar to what we've seen in at the state level, although we've seen this dramatic decrease in the number of hospitalizations at the state level, we are seeing large numbers of deaths being reported. We are also seeing that here in the city. The state at last report reported 377 deaths for the city of Hartford. Our current last review on Friday is we are actually at 386 deaths, and that's just the difference there being when the state pulls their data and when we're pulling our data. They have to pull it earlier in order to make the report. But we did see 29 deaths reported in the last 1 month, 30-day period. So I suspect that we may see that for another couple weeks, double-digit numbers, simply because deaths are a lagging indicator and we wait for OCME. The difference also, just so you know, sometimes deaths get reported by OCME, the Office of Chief Medical Examiners, way past when the death actually happened. So though we've had during that period 38 deaths reported, 29 of them were actually in the 30-day period. The other ones were older deaths that had happened previously that were now being reported as COVID-related deaths as they come through from the Office of Chief Medical Examiner. Unfortunately, our vaccination rate isn't as high as I would like to see it. We are currently about 65% of individuals in the city have had their first dose, with slightly over 56% being fully vaccinated. I don't have the overall booster in front of me, but I believe we're about a third of our community has been boosted. Definitely big differences in ages. Our 65 plus population, we have close to 58% have received the booster. But then it goes down dramatically under that. So we're going to be doing more pushes for boosters. And if you are not aware at this point in time, we are currently running an evening clinic for vaccinations. So we are running a clinic from 4 to 8 every Wednesday, which I think is a great thing for us here in the city, because the only evening clinics were really the pharmacies, which have been challenging for our residents to get appointments at. So this provides our residents an opportunity to come. If you have children, wait till they get home. As you know, we have many children that are bused both across the city and across the region. They can get home, they can eat, parents can get home, grab them, and then bring them to a clinic without having to feeling like they're rushing out the door every minute. So we hope to see more people come through that evening clinic. But that's the report for now, and I hope that next month, when I give you the numbers, we're just looking at 100 people or maybe even less.
That'll be amazing. So I'll open the floor to my council colleagues. And again, if I don't see your hand up, just feel free to chime in. Anybody has any questions for Director Arroyo?
Through you, Mr. Chair.
Yes, Councilwoman.
Thank you. Not a question. I know I say it all the time, but I want to thank you again. I'm thinking about a year ago at this time when we were all starting to get vaccinated, and I'd like to think that for us who chose to do that, that some of the things that have happened or not happened is because collectively as a city, we focused on doing that. You constantly gave us your leadership. We were able to disseminate information consistently through this committee. As you said, with my other hat, my day hat, congregate setting was a struggle this last month, probably hardest that it's been since the beginning of the pandemic, but not with the same severe results. So that was the one good thing that we could keep our eye on. But I just wanted to thank you, Director, and I wanted to thank you for your continued leadership.
Thank you. I appreciate that. And, you brought up a good point. We're a year and maybe 3 weeks into vaccinating as a health department. And I had my team just pull up a quick stat on how many clinics we have had, and those include community clinics. And as of last Friday, we had hosted 171 community clinics at our health department. So, you're looking at an average of about an event every 2.5 days over the last year, or every 2 to 3 days over the last year. And that includes weekends, that includes door knocking events, of which we'll be starting those again now at the end of February. And we'll continue to do it. Our goal is to make vaccination as easy as possible for as many individuals as possible. And I firmly believe that this is the way that we're going to get back to normal. And to your point, Councilwoman Rossetti, people got sick, but it wasn't like it was before. And that's what's important right now.
Thank you. Anyone else have any comments, questions? All right. Seeing none, I just have one question for you, Director Arroyo. Again, I believe you said it earlier, but I was multitasking. So just for clarity in terms of masks in school, the governor said that it's on the municipality. And does that mean it's a team of folks that is going to decide in Hartford? Or will it be the State Department of Ed who, if you could just give us clear guidance as to who's going to make that final call? Will it be a team of folks?
I'll give you the guidance that's as clear as mud right now for us. So all we have is what was said at the press conference, which is that it will be a decision that will be left up to the school districts.
Okay.
And we know that we have worked closely, and most of my colleagues, my 60 plus colleagues, have worked closely with their school districts on this issue. So I suspect it will be what we've done from the beginning when I've made recommendations or provided guidance to both the mayor and to the superintendent, that there's conversations that ensue between the mayor's office, my office, and the superintendent's office.
Okay. Thank you very much. All right. I'll see. Is there anyone else that has any questions or comments? Okay. Seeing none. Director, thank you very much for updating us. And again, thank you for all your leadership. Just want to make a comment. I want to dedicate this meeting to my grandma, who lived a long life. She received a lot of city services from the city, from the Department of Aging, from services and all kinds of things. And she was very vital in my life, and very participatory in city services in her community. So Aelita, this meeting is dedicated to you. So I'll take a motion to adjourn.
So moved.
So move. Second.
All right. Everyone have a good evening.
Night.
All right. Bye.
Bye.